Joining us live on the broadcast now is Dr. Tat-Sum Lee with the Chautauqua Center here in Chautauqua County. Dr. Lee, thanks so much for being here today. We appreciate your time.
Glad to be here.
First off, I want to ask you, what has it been like over the past few weeks here for your health center to prepare for the COVID-19 outbreak?
As you see, everything is not usual anymore. We don't see patients directly. Mostly we go with the telehealth, means you use the video to talk to patients. And if they need to be seen, we're still seeing patients. So try to eliminate direct contact. So that's what we're doing now. We're doing a lot of telehealth.
And you see a lot of patients here in the local area. What are you advising your patients to do in addition to those who maybe will come for COVID care? It seems like there's still many people out there who need assistance outside of the outbreak.
Yeah, I think that unfortunately that normal problems still going on with people have allergies in this area, still have sinus infection, throat infection. We still have diabetes people, hypertension. They don't take vacations. We still have to take care of them. So that's the thing that you try to working a line that, we can handle by radio. If not, we still have the people come in and then we check the temperature, make sure they're not having the COVID infection, and then we can see them.
And I would imagine that that's why it's so important that health officials are telling us that if we do feel like we have some COVID symptoms, we need to tell our healthcare provider ahead of time before going to the office, because there could be other people there who maybe, like you said, are having a sinus infection. Is that why it's so important to have these telemedicine type of resources available where you kind of pre-screen the patients even before they come into the office?
That's correct. Some people, if you're coughing, have short of breath and with fever, that is a sign of COVID infection. So, we need to know so we can prepare. We still can come in, but, so we can prepare. And as we know that, there's a certain portion of the people have the virus. They can transmit to other people, but they still no symptom. Yeah. And also, the incubation period is 2 to 14 days. Sometimes they don't have symptoms. Now they still can spread the virus. That's why it's important. We need to know ahead.
Now, we talk a lot about the importance of cooperation as well between officials here locally and the medical industry. What has it been like for your medical group to work with leaders here in the community?
We are right now. We are meeting almost every other day a meeting. Try to what we need. We still, have the two locations in Jamestown and Duncan with testing. If they need the COVID testing, we will test it. All you need to do is to have your physician write in the note, and then we test it, and then the report will come to your physician.
Now, speaking of that testing, there seems to be a lot of frustration with people that we've talked to about the lack of test kits available and the fact that many people in the community really want to get tested for the virus. How can you explain to our viewers the process for someone who thinks they might have COVID-19 to get diagnosed properly?
Yeah, as you know that this COVID-19 is similar to a lot of these common colds. You don't want to testing everybody with common cold. As long as you have fever, coughing, and especially come from other hot spots, we will test it. And besides that, if you are working in a nursing home, health facility, with symptom, with very little symptom, we will test it. So it's important to test all the health workers. So that's why we give, even though the testing kits are not abandoned, but we will provide all the healthcare worker testing if they need to be tested, so they can protect other people.
Absolutely. The priority has to be especially for those on the front lines right now until we can find a better process to test. Early on, officials were having a hard time of keeping track of how many people were getting tested for COVID-19, and they were saying it was because healthcare providers may not have reported them to the county because they were only reporting positive cases. Now it seems like that data is more readily available as they have a better understanding of it. Do you know why there was that gap in the beginning?
In the beginning, some of them lab tests, they have the test kit and then provide them private physicians, they test it, and then they're not positive, they're not reporting. But right now, as in the Chautauqua County, we have, few, ourselves and the WCA also testing now. So if any, we give a check on how many people we're testing, how many people were positive, and we know, exact number of how many people were tested.
Now, what is the treatment process like for COVID-19? I know that there's certain medical groups nationwide who are trying to work to have a vaccine to prevent it, but if you had a patient with COVID-19, what would you suggest for them to do?
If you test the COVID-19 and then, right now, no officially medication approved for the test, but as in New York, we, especially in Buffalo, Collider, and we were approved to use some experimental medication like everybody talk about, hydroxychloroquine, and also other antiviral medication too. They are used in Buffalo and as ECMC and Buffalo General. Now, I know in the Roswell Park also used it.
Okay, so for patients there at the Chautauqua Center, do you know how many people you've tested and how many people have tested positive for the virus?
So far, we more than 200 tested. Luckily, we are only 2 positive.
Wow, and I know officials are saying that, that they're urging people to act like the virus is out there in the community, but seeing the test results now and seeing that there's so many low numbers, do you know why there's only so many people who are testing positive for it, even though officials are saying you need to be careful and you need to try to assume that it's out there in the community?
I think that most of the time, I think that in here, we live in the rural area, people live far apart, and most of the people around here are pretty healthy. So maybe we had it, we don't know we had it, and then we carry the virus, but we don't have symptoms. Because as you know, in Chautauqua, this area, we have fresh water, fresh air, so I think that helps some. And people, especially when these things outbreak, then we don't travel a whole lot. Not a lot of people from Asia and Europe flow in here.
Right, exactly.
And not great.
And they say it's really important for folks who, if they are experiencing symptoms, to contact their doctor for telehealth, which they could do through the Chautauqua Center. What would you kind of give advice to someone out there who maybe says, I don't really have a doctor, which I know it kind of sounds crazy to me because it seems like we all kind of have a physician. But if someone needed to get and come receive services from the Chautauqua Center, what's the best way for them to do that?
We are Chautauqua Center. We serve everybody, regardless. You have insurance or not. We take 100% everybody. If you don't have a primary care, we'll be glad to enroll you to our program. And if you have been in a hospital, like you come from go to visit somebody in New York City or something like that, we definitely it's a you need to make sure you're okay. If you have fever over 100.4, and with coughing, especially dry cough, and then you need to be tested. And some reports say that in rare occasion, people don't have any symptoms except they lost the taste, the taste or lost the smell. And some people have GI problem, vomiting. That also can have an indication too, but there's a rare case, but it's still possible.
All right, so certainly the recommendation then, if someone has concerns, reach out to their doctor so they can perform that initial exam.
Yes.
All right, Dr. Tat-Sum Lee with the Chautauqua Center. Sir, we know you're busy, and we thank you so much for your time today. It's a really important conversation to have.
Thank you. Thank you.